Because this presentation was made mostly for doctors, it's really data-based, mostly from medical and economic literature. I want to start with this slide here by Luc Fildes, who was a famous Victorian painter. He painted this picture because his son, at the age of 11, actually died of typhoid fever on Christmas Eve in 1890. This picture actually represents the old-fashioned idea of the medical professionalism and the caring heart of medicine. And the reason I want to start with this is this was the signal piece of propaganda used by the American Medical Association to oppose the passage of Medicare in 1964, saying that the country would lose the heart of medicine and medicine would be destroyed if Medicare was passed. So this piece was everywhere in the United States back in the 1960s, distributed by the AMA about what we would lose. This is a more contemporary view of healthcare reform, with the president challenged to make a mess out of the mess that things are. So this is me, and I belong to the Physicians for National Health program, which is a national organization. There are over 16,000 physician members. You may have heard of us because at the start of the Senate Finance Committee hearings on healthcare reform, some of our members stood up and protested that single-payer reform was not being discussed, and they were ushered out of the room and arrested. Subsequently, they have been invited back to talk both to the staff and to other congressional hearings, especially in the House of Representatives. And some of us have met with Senator Baucus himself. Senator Baucus himself cannot show his face anywhere in the country without meeting with protesters for his lack of attention to the publicly demanded massive reforms involved in creating a single-payer system. This slide illustrates the major concern which is abroad in the land, and what we have is from the year 2000 to the year 2007, rise in inflation and the rise in wages, which is about 25% in those 8 years. But what you see in the blue line is the rise in healthcare premiums for people under the age of 65, which exceeds 100% in 8 years. And it's that gap between income and the expense of the healthcare system that has the country up in arms and has the president very worried. You'll notice that this comes from the famous economic journal called Cancer, which is put out by the American Cancer Society and sent free to all physicians. You'll see why the American Cancer Society was interested in this in a minute. So the next slide illustrates the same graph but separates things out. If we go from 2000 to 2008, actually 75% of the rise in costs are due to the costs of medical services. But the rise in costs of the administration of the insurance companies has risen 106% in the same period. We have here a slide which shows national health expenditures per capita and as proportion of gross domestic product, and this goes from 1960, we were spending $140 per capita, to 2005, where it's close to $4,600. Here in 2009, it's closer to $8,000 per person per year, and instead of being 16% of our gross domestic product, it's now closer to 18%. This is a very complicated slide, but it shows a great insight. On the bottom, you have per capita gross domestic product in something called PPP, which is an econometric term which means parity purchasing power. So you can compare the economies of different countries. So as gross domestic product goes up, this is the amount of money spent per person on health care, again in PPP dollars. And you can see most countries are rational. As national income goes up, they devote more and more of their resources to health care. So you have a whole bunch of countries from Poland to Switzerland all falling on the same line. And if the United States was on that line, it would be here and spending about $3,000 per person per year. Instead, actually, we spend closer to $6,000. And this gap here is what is econometrically the gross inefficiency of our healthcare system. And this amount of money, approximately $2,000 per person per year, is the amount of waste created by the private health insurance system, the waste and inefficiency, compared to all the other major countries in the world, and why our healthcare system has great deficits. Here is the primary deficit that we're interested in, which is that 45 to 46 million people in the year 2007 were left out of the healthcare system altogether. Now, this is a graph which shows unemployment rising, and this goes to October 2008. And what happens when unemployment rising, since so much health insurance is employment related, you see this graph, which is the number of people estimated to be losing their health insurance in the months since June of 2008 through March of 2009. And I need to point out to you that here in 2009, approximately 300,000 Americans are losing their health insurance in a month. That's an unbelievable number. That's 10,000 a day. So that's the kind of pain and anguish that's being spread across the country during this recession. Here's another little known fact. These data is from late 1990s, but it still holds true that if you look at, these are different years, this is rural adjacent, and this is urban. This is the percent of non-elderly uninsured. And you'll see that the demographic that is most non-insured in America is not the urban people, but the rural people. In fact, those conservative congressmen and senators who represent rural districts have the people as their constituents who suffer most from the inadequacies of the healthcare system. They, in fact, are screwing their constituents by opposing reform. There is not only more uninsured, there are more people on Medi-Cal, there are more people who are working for employers who do not provide insurance in the rural areas. And a rural single-family health insurance plan in the United States today in, say, Montana, Iowa, or Maine may cost between $15,000 and $30,000 a year just for premiums. What happens to the uninsured? Of course, they postponed care. They needed care but didn't get it. They did not fill prescriptions, etc., etc. Time magazine back in May had this. So you think you're uninsured. And this raises the second issue. Those people who the Congress are touting now as loving their current insurance plans, when you get sick, they find out that the co-insurance and deductibles are extraordinarily high. I had a young man come in the other day who on 4 occasions has fallen to the floor, doubled over in pain from a gallstone attack. And it's been 6 months and he hasn't had his surgery yet. So I called him into the office and I said, "Why haven't you had your surgery?" He said, "Because my copay on the operation is going to be $1,000, my insurance company tells me, and I don't have the money." So he's fully employed, earning a good living, relatively speaking, and he has, quote unquote, good insurance. So Bill Maher, who you all know, had a great joke about this. He said, health insurance is like a hospital gown. It's flimsy, it's expensive, and it doesn't cover your ass.
Who said that?
Bill Maher. This is a similar thing. This is a study by the Kaiser Family Foundation and again the American Cancer Society, Spending to Survive. What it is actually 25 people, all of whom had cancer and all of whom were insured and all of whom either went broke or bankrupt because their insurance did not cover the cost of their care. Here's the table of people, 25 anecdotal stories. Each patient is identified by name. The consequences of financial costs of cancer by insurance status. So blue is ever uninsured and red is always insured. So used up all or most of savings, 46%. Borrowed money from relatives. Unable to pay for basic necessities, 41%. And declared bankruptcy, 6%. among the uninsured, but you'll see it also happens to insured people. Now, here's a study done by my colleagues who were members of Physicians for National Health Plan, and this was published in May of this year in a professional journal, The Medical Bankruptcy in the United States. So you know, a couple of years ago, the Republican Congress changed the bankruptcy laws and made it harder to get bankrupt because it was so much personal irresponsibility. This study went and actually was done by doctors and economics students, and they went back and they pulled court records, and then they did a random sample of people who declared bankruptcy, and they got up to about 3,000 cases. And in those 3,000 cases, 62.1% of the personal bankruptcies were due to health reasons, medical expense reasons. So it's not a matter of irresponsibility, it's a matter of the greed of the creditors and the lack of universal health insurance. Fully 60% of all personal bankruptcies in 2007 were due to medical or health-related reasons. So this is my simple view of the healthcare system. We have you and me down here. I've been a patient too. And if there's any market in the healthcare system, we get to choose, or our employer gets to choose our insurance company. Now, I point out carefully that the role of the insurance company is really that of a bank. What they do is they collect money from you and me, and they store it, and then they pay it to providers. Okay? They really have only a pass-through function. They need to be a bank. And the fact is that to me as a patient, it should make no difference whether the bank collects things called premiums or other things called taxes. What we want is an efficient bank that doesn't take too much money in expense and pays the providers in an efficient way. So in the system, everybody overlooks the values. And I've identified 4 values in the healthcare system. Obviously, the most important is to maximize healthy states. That's what we're talking about. But there's a second one, which Democrats talk a lot about, but it doesn't get into the media these days. And you have to recognize that even Barack Obama cannot stand up in public and say, I want to reform the healthcare system because we need more social justice in this country. If you go back over all his remarks and you look at how he defines the healthcare system problem, it's a financial problem, it's a middle-class problem. He never talks, although I'm sure he's concerned about, social justice. The tenor of the country is so unhinged that you can talk about social justice issues having to do with abortion and contraception or race relations, but never about poverty these days, or the 45 million uninsured, or the bad statistics among racial or ethnic minorities. Of course, the third and fourth values are market values, and since the Democrats came to power, these are a lot less emphasized, but they have crucial importance for understanding the healthcare system. Now, I'm going to talk about the actual values of the healthcare system. Now, obviously, life expectancy is the common denominator for everything, and here you can see life expectancy in the United States arrayed against a whole bunch of other countries. And you can see that we are really, for years and years and years, been way behind in that. Now, the criticism was always made, but life expectancy, that's a mixture of everything, and it has very little to do with medical services. So I'm going to show you some data that cones down on actual medical services and gets away from the big generality of life expectancy. This is infant mortality. The United States, again, leads the pack among industrialized countries at 6.7 infant deaths per 1,000 live births per year. Now, I would point out to you that the best country on this chart is Japan. And the fact is that Japan only had 3.5 infant deaths per 1,000 live births per year. But the striking thing about this is 2004. In 2004, Japan was in the 8th year of a 10-year recession. Okay? So even in bad economic times, their healthcare system served their citizens in an admirable, extremely admirable fashion. The other thing is that this chart does not show there is one country in the world that's better than Japan, and that country is Singapore. Singapore has 3.4 infant deaths per 1,000 live births. I happened to be in Singapore 2 years ago, and Singapore is an ethnic minority country. It is divided among Malays, Indians, Chinese, and it actually has a lot of ethnic enclaves. And the fact is that a lot of the citizens of Singapore are very poor. I was in ghettos in Singapore, places that would look as downtrodden there as they do here. But again, their national system has provided health care to all the citizens, and their infant mortality is the lowest in the world. Now here's a comparison, odds of mortality by race and insurance status. And you'll notice that this is no small study. The N is 300,000 people. And it's again from a radical journal called the Archives of Surgery, a leftist journal if I ever saw one. And you'll notice that even Hispanic people who are insured have a better life expectancy than white people who are uninsured. Insurance makes the difference, much more than race or ethnicity. Here we're getting down to real medical conditions. This is potential years of life lost due to diabetes, a very treatable condition. And this is from the Organization for Economic Development and Cooperation. So they compare the United States to New Zealand, Canada, France, Switzerland, etc. And you'll see again, the United States has the worst record. We have 90-odd years of life lost due to diabetes per 100,000 people, while Switzerland has less than a quarter of that. This is due to the healthcare system, to no other factor. Now this is a little bit complicated slide, but again it's good data. This is an econometric study, and it was done in 1997 and repeated in 2002. And it has mortality, that's deaths per 100,000 people, amenable to health care. Okay, so what this person did, who was at the London School of Economics, is she made up a whole bunch of parameters from vital statistics that are available in all civilized countries, put them together in an index. And the vital statistics included such things as all children's deaths under the age of 15 due to infectious disease, all tests from testicular cancer, which is a curable cancer, 50% of the cardiovascular deaths under the age of 75, not all of them, and diabetes, years of life lost. And she made up an index through all these treatable medical conditions. And she compared the countries of the world back in 1997, which are the white bars, and the United States is over here. And you'll see in 1997 we actually scored pretty well compared to other countries. So this study, using the same statistics, was repeated in 2002. And what happened? Most of the countries in the world have organized healthcare systems. They saw this study back in 1998 when it was published, and they endeavored to correct themselves, and all of them had major improvements, except for one country. Now the United States scores worst in the world on this parameter. You understand the gravity of this slide and its significance? No one can stand up after you see this and you read these articles and say, we have the best healthcare system in the world. It's impossible. If the United States did as well as the better countries in this study, if we did as well as the top 3 countries, we would have saved 100,000 lives in 1 year. 100,000 lives. If we just did as average as the other countries, we would have saved 75,000 lives. That's amazing. Now, this is an article from the journal Cancer from the American Cancer Society, and it's really a very inspirational article to me, and it was the article that I read that got me out to put together this presentation. This was published late in 2007, and it contains this amazing graph. This is cancer survival by insurance status. Again, from that radical left-wing communist organization called the American Cancer Society. And what they found, this is 5 years, and this is all kinds of cancer except skin cancer, okay? And this is 5-year survival. So if you're insured, which is the blue line, it shows that you have a 75% survival at 5 years, all cancers. But if you're uninsured, the red line, or you're on Medicaid, the green line, then your survival is about 60% at 5 years. This is the gap. Again, that 100,000 lives that we saw in the previous slides, this is where the rubber meets the road. So in 2008, what did the American Cancer Society say? Our campaign this year is not to train more cancer doctors. It's not to fund more research, and it's not to build more buildings. This year in 2008, they spent all their discretionary funds promoting universal national health insurance, because they figured out what President Obama hasn't figured out really, which was the best way to improve the health of America in a cost-effective way is to provide universal national health insurance. Now, to get detailed about it, this is breast cancer. And what you see, although you can't read it on this small screen, is that this is whites, this is African Americans, and this is Hispanics. Stage 1 is early breast cancer. If you find breast cancer at stage 1, you can virtually cure it. So you can see that the blue are the insured people and the red are the uninsured. So in any ethnic group, if you're insured, you have a much higher likelihood of being discovered in stage 1. Whereas in stage 4, you can see how much higher the red bar is. In stage 4, you're virtually going to be dead within 5 years. So again, by insurance status, it's a much bigger discriminant on what's going to happen to you when you get cancer than ethnicity or other economic factors. This is colorectal cancer, the same kind of graphs. If you have insurance, look at the disparity here among white people. So many more diagnoses at curable stages. Now, this goes and takes us off into a different tangent. This is an analysis of who gets tested for colorectal cancer in a preventive medicine sense. And you'll see, if you compare people with health insurance, people who don't have it to people who do, you have about 2 times as much more likelihood to have been tested for cancer. And again, this is 120,000 people in this survey. But another thing that's important is whether you have a personal health care provider. And this emphasizes the importance of primary care, not specialty care in the healthcare system. So if you have no professional healthcare, personal healthcare provider, and you set that as 1, you see you're 3 times more likely to have been screened for cancer if you have a personal primary care provider. Now, the United States is losing primary care in droves. Here you have shift in specialties. This is percentage of growth. Anesthesiology grew 150%, pathology grew 122%, and down here family practice shrank 51% from 1998 to 2006. So there's less geriatricians, less gynecologists, less obstetricians, and more in the high-paying specialties which have limited work hours. Just for example here, we see that these medical schools, who graduates with the most debt? Here at the University of New England in Maine, the average indebtedness for a 2007 graduate from medical school who had medical debt was $200,000. Now that person is not going to go into family practice, or those people. So the same at other medical schools. That's an astonishing number. In Canada, medical education is free. In Switzerland, medical education is free. In Germany, medical education. I think so, partly. In Italy, it's free. Now, this is pediatrics. Okay, this is from the journal Pediatrics. Again, a professional medical journal, peer-reviewed. Here you have people on kids on public or no insurance compared to kids who are insured. When you talk about hospitalizations, 2 times as many hospitalizations. When you talk about sudden hospitalizations through the emergency room, 2 times as many. When you talk about chronic disease, 3 times as much. When you talk about vaccine-preventable diseases, okay? Vaccine-preventable diseases should virtually never happen. Almost 3 times as much. So it's hard to read down here, but you have in 1 year over 2,000 excess pediatric deaths among the uninsured population, and a total cost of over $5 billion. Now, this is to give you an intimate sense of what it means, the way the healthcare system works when you're insured, say. So this slide and the next slide are taken from me by a handout for people with cystic fibrosis. Say you have cystic fibrosis and you're now 30 years old. When you were born, the average cystic fibrosis patient lived to be 4 years old. And due to advances in medical technology, you're now 36 years old, okay? You're lucky because to the age of 21, your health care was subsidized by the government through Medicaid, something called Crippled Children's Services and programs like that. Virtually guaranteed health care by the government, state and federal combined. But when you're an adult, you lose that. So you're so happy your husband has a job and he has insurance. So let's say you don't lose that insurance, but the insurance company changes the rules. Now, an insurance company, one of the things they ask, Cystic Fibrosis Foundation asks their patients, does the insurance plan you're getting cover medication? Now, it's very common these days for an insurance plan to take medications and divide it up into tiers. The first tier would be generic medications that are inexpensive. The second tier might be brand name medicines that are not so badly off, that are somewhat expensive, but you have to pay a little bit more for them. And then the third or fourth tier are the very expensive medicines. And used to be for the third or fourth tier, you would pay a copay of like $40 or $50 per month for the expensive medications. But without any supervision and on their own initiative and with no oversight, most insurance companies went and changed their copay for tier 4 medications from $50 a month to 20%. So if you're a cystic fibrosis patient, you have to use these medicines called Pulmozyme or TOBI. Those medications cost approximately $7,000 per year. So to round it off, say $10,000, 20% of that is now $2,000, where you used to spend less than $500 for that medication. But this is the kind of medication that's kept you alive for over 30 years. And now the problem is you've got to scrimp and save in order to continue on your medications, even though you're fully insured. And that's the kind of pain that the insurance industry is inflicting upon people all around the country. Does that make sense to you?
No.
So not only do we talking about the actual provision of care, but the capability of the system. So here's an international survey done by the Commonwealth Fund, which is an American foundation, where they compared difficulty getting care without going to the emergency room in 6 countries. And again, you see the United States scores the worst. Here's access, coordination, and safety. Access problem because of course, coordination of care between specialists and whatever, and then actual errors. And again, by actual survey of actual patients across the world, you see that the United States scores worse on all these parameters. Not a healthcare system you want to brag about. So now to move to the other end, we're going to talk about the medical marketplace. Now it's very important to recognize that insurance is a very, very important principle for the healthcare system, and this is the reason why. If you take the top 1% of the population that spends money on healthcare, this is of the whole United States, 1% of the population spends 23% of all the money on healthcare. And if you have the top 5%, they spend fully 50% of all the money on healthcare, personal health services. At the other end of the spectrum, 50% of the population spends virtually nothing. So in order to adequately prepare for the extraordinary expense and uncertainty of severe illness, you really have to have everybody in the same boat to have a reasonable premium, because these expenses are monstrous. And these folks, although they're healthy, if they don't share some of their wealth with the rest of the population, we're certainly going to fall off a cliff. That's what insurance is. Okay? So what happens? You have 10% of the population spending 70% of the money. Now this includes, this 10% of the population might include, if you will, Medicare patients, HIV patients, crippled children with cerebral palsy and cystic fibrosis. And guess how many of those patients are subsidized by the government? A lot of them. And what does the insurance industry focus on? They focus on all these people. And those are the people that are enrolled in the extraordinary complex private health insurance system. And because they spend so very little money on personal medical services, it's why the insurance company makes such extraordinary profits. Because already the government subsidizes huge numbers of very sick people, subsidizes the care for them. So we have this cartoon. These gentlemen have volunteered to help drain the healthcare swamp. And you can see who the alligators are, and you can understand the cynicism with which I greet the office of the hospital industry, the AMA, and whatever, to help Obama save money in the system. It's just not going to happen. Now here's another important insight. This happens to be in 2002, the latest figures, but this is an HMO, which is supposed to be a well-organized, efficient insurance mechanism to save money. And what is this? You see that the median medical expense ratio, now that's a euphemism, because in the insurance industry they call medical expenses medical losses. Why is it a loss? Because to the insurance industry it's a loss to their profit. So the medical losses for the HMO industry amount to 86%. But what's the opposite of that? That means that of every $100 that is spent on insurance premiums, they keep $15 off the top of it for just being the bank, for collecting the money from one set of people and paying it to the other. They keep 15% of that, and that's an industry average. Okay? So the cost for health insurance administrative costs goes up in 1986 from less than $100 to over $400 per person per year. That's $400 lost per person from the healthcare system. Here's the same figure compared to other countries. Switzerland happens to be a very expensive country. Why? Because they, like us, have a multiple insurance provider system. They have multiple insurance companies financing their healthcare system. So even for them, it's expensive. I should mention that in Switzerland, every insurance company is regulated and required to be not-for-profit. So it's a totally different atmosphere than ours. What happened in the United States was that prior to this graph shows the growth in physician manpower since 1970. You can see that little green line sliver. And what happened in the healthcare system was, does anybody know what happened between 1985 and 1990? Can anybody tell me? That's when the HMOs came in. And why were HMOs come in? They were coming to make the healthcare system cost effective. So what happened? The insurance companies came in, they grabbed hold of the healthcare system in a commercial way, and you can see the escalation in number of administrators required in the healthcare system. So any money that was saved by making medical care more effective and efficient was not fed back into the system to provide more medical services. It was fed into the system to feather the bed of the insurance companies. This is a study that was published May 14th, that's just a month ago, and one of the authors was a professor at UCSD here. They went to San Francisco and they surveyed several medical groups, and they found the amount of time and resources spent on dealing with the multiple insurance companies. And by their actual study, they found that the total annual per practice cost per physician in a year to deal with insurance companies was $70,000. So as a physician, on the average, this is $70,000 in resources in my practice that are drained from patient care. That's how to interpret that. So what do they teach in medical school these days? They don't teach anatomy. They teach how to deal with insurance companies. And what do insurance companies do? Again, this is old news from the Wall Street Journal, June 17th, just a month ago. President Obama was complaining to the insurance companies about what all those administrators do. They do something called rescissions. You know what a rescission is? That's when you get insurance, you pay for it, and then the insurance company goes back and investigates you and finds out that you omitted something on your application. They usually do that when you start spending money. I get a letter almost every other day from an insurance company. Please send us your records prior to the date you first saw this patient under our insurance. Do you know any other doctors they ever saw prior to this insurance, et cetera, et cetera? Because if they can prove that you didn't tell the full truth on your insurance application, they will stop paying for your medical care. That's called a rescission. So in a 5-year period, they showed that there were 20,000 people who had rescissions, and the insurance industry saved $300 million in claims. In California, the insurance commissioner has attacked WellPoint and universal health care for this practice, Blue Cross Anthem, and they've actually fined them several $100 million and forced them to reinstate policies, because the insurance companies wouldn't say that you lied about having breast cancer, which you now have to get treated. They would say you lied about going to see an allergist for a cold, and then you develop breast cancer. We're not going to pay for your breast cancer treatment because we're taking away your insurance. You omitted to put in the allergist when you applied. That's what a rescission means. I had a girl in the office the other day who works as a waitress, but her employer doesn't provide insurance, and she got one of these Blue Cross Anthem relatively inexpensive policies for relatively young people with a premium of $200 or $300 a month. And it happened that she had complicated migraine, and she was on birth control pills, and that's a combination which can produce a stroke in a young person. So I said, rather than giving you any more birth control pills, I want you to see a gynecologist to get better advice. And then I asked her, how long have you had this insurance? And she said 3 months. And I had to ask her, because I'm a sophisticated doctor, I don't know any other doctor that would ask this question. When you're on your application for insurance, did you tell them that you had migraines? Because if they find out that she's now spending to go see a specialist, they can recheck her application and see if she ever told them they had migraines, and they will cancel her policy, even after she's been accepted. Now, the other thing that's shocking, okay, this is 2009, right? We're in the middle of a recession. January, February, March 2009. Okay, this is total net income in the first quarter. This is from the Securities and Exchange Commission. The biggest insurance company in the United States is the United Health Group. Okay, they do Secure Horizons. Okay, what's their profits in the first quarter of 2009? $984 million. $1 billion, that's their profit during a recession, while we're all wringing our hands and the congressmen in the White House are going around saying, oh my God, the country's in crisis. They don't talk about the insurance companies. Obama had a town hall forum on ABC News. Did anybody see that? He introduced a guy who, oh, I don't have the slide. He introduced the president of Aetna Health Insurance. Aetna's at the top of the list here. They only had a profit of $400 million in the first quarter. As his friend, he happened to be a black fellow, the president of Aetna Insurance, he neglected on national television to point out that the guy earned $23 million in income in 2008, that individual, okay? And we're wringing our hands saying, where are we going to find the money to pay for a reformed healthcare system? I know where the money's going. It's going to the insurance companies. Now, not only is there insurance overhead, but the insurance overhead requires employers to have costs, hospitals to have costs, nursing homes to have cost, administrative costs of practitioners, that's the $70,000 I talked about before, and home care administration. So if this actually is old figures, but if it's the total loss to the healthcare system is 4 times what the expense is for the actual insurance companies. So if we got rid of the insurance companies, and that's the point of single payer, or Medicare 2.0, Medicare for everybody. Medicare has insurance companies to administer it, but they do not have the massive overhead. Medicare has about 5% overhead. The private health insurance system imposes a 30 to 35% overhead or loss of resources to the healthcare system. That's $300 billion a year that could be transferred from bureaucratic waste to caring for people. That's what PNHP is about. Now, you often see this, and you mentioned this, sir. Whatever happens, the government better not get involved in my Medicare. And on that town hall forum, President Obama spent with Diane Sawyer and who's that fella, about an hour and a half talking about health care. But because of the way the program was set up, and because they tried to personalize it, about 15 minutes of that program was spent talking about personal end-of-life circumstances. And so they talked about President Obama's grandmother, who had recently died, and then they chose a lady at random from the audience who was complaining that her mother, at the age of 100, was not allowed by her initial physician to get a cardiac pacemaker, and then she found another physician who would put one in, and then they showed a video of her mother being very happy and alive 5 years later at 105. Now, that's a nice story, and both stories are very heartrending, but the fact is that those people are already involved in 100% government-run, single-payer health care, and they have nothing to do with the town hall forum on health care reform. Yet they use those circumstances to divert your attention from what I'm talking about, that people have a poorly performing healthcare system, it lacks primary care, and tremendous amount of money is ripped off the top and taken away from medical services. Here again is another important statistic. So this is experiences with health insurance plan and satisfaction of quality of care in 2007 by insurance status. Guess what? Those people who are elderly with Medicare have the greatest satisfaction, 57%. While those people with the wonderful commercial insurance, they're anywhere from 36 to 46% satisfied. The fact is that most people don't like the insurance they're having. It's only the propaganda that they're putting out that says, oh, we have to save the system for the people who love their insurance. This was the meeting with Diane Sawyer on TV. So there's a great deal of public support for reform. And of course, as you know, the reform bill that most fits the bill is the one that they're not talking about, H.R. 676, sponsored by Congressman Conyers. And you'll all remember how much publicity Dennis Kucinich got when he was running for president for supporting this piece of legislation, which is what my organization supports. Automatic enrollment for every resident of the United States. Free choice of doctor and hospital. This is not socialized medicine. Doctors and hospitals are private. They have free choice. They do not work for the government. The government does not own the hospitals. Doctors and hospitals remain independent, but fees are negotiated. A public agency processes and pays the bills, and it's financed through taxes. So the bank becomes the government instead of the insurance company. So since it's been about 45 minutes, I'm actually going to stop there, and we can have some discussion. Thank you very much for coming. The question was talk about capitation. Well, capitation is what happens in health maintenance organizations where a doctor or medical provider, like a hospital, is paid per person per month rather than on a fee-for-service basis. Now, it so happens that capitation may be good and bad. And what you hear from most doctors is, oh, I hate capitation because I provided so much care to Mary Smith and I only got paid $20 last month for seeing her. Well, the fact is that I watch my practice and I know that on the whole, I have about 40% of my practice is capitated. And in terms of my charges, okay, if I average out over a year, those people that I see and spend time on, and those people that I don't see, I get paid approximately 90% of my billed charges for my capitated patients. I will tell you, if I have a private fee-for-service Medicare patient, I get paid about 55% of my charges. And if I have a private insurance patient, I get paid about 45% of my charges. So my capitated book of business is the most profitable patients I have.
As long as they're young and healthy.
Oh no, I have quite a few sick and elderly, older, but less than 65 capitated patients. I have a general population. I have, I can tell you, 1,365 capitated patients in my practice. 213 which are over 65. The questionnaire is pointing out that capitation thrusts the risk on the doctor. So again, I have 1,000 more capitated patients. Perhaps if I had 30 capitated patients and one of them got hit by a bus, I would lose a lot of money. But I will tell you, I'm affiliated with a major physician organizations affiliated with Sharp Hospital, that the specialists in our organization, many of whom are on capitation, find that they are better paid on capitation than they would be by private insurance, because we run an efficient, organized medical group that makes fluid transfers and consultations, manages people in the hospital appropriately, and provides high quality of care, and we're able to have a net income on capitation. It is possible, and it's not a total scam. What capitation was put in to fight was the original Medicare, which let fee-for-service medicine bill open-endedly in their fees and multiply the procedures and numbers of doctors, and so had an open-ended budget of expense. And as I pointed out, the insurance companies somewhat curtailed that, but the money was not redistributed into more medical care. It was siphoned off by the insurance companies. Any other questions? The question was, what about the public auction, which is on the table as politically practical as compared to single payer, which has been, if you will, by conventional wisdom, said not to be politically feasible? I would translate that into say, the moneyed propaganda machine of the insurance companies has made it conventional wisdom that single payer is not practical. But really, as a practitioner, for someone to call up on Tuesday morning and say, okay, now you don't have to electronically send your bills to these 1,300 insurance companies, just send them to this email address, just like Medicare, it would make my office much simpler and I could probably lay off one staff person. So they could do that overnight and make life wonderfully easy for me. It's not an impractical thing. It's only the propaganda from the insurance companies that makes it not feasible. And as I pointed out by actual data, less than 50% of people are happy with their commercial insurance. And most of them are happy with their commercial insurance because they haven't used it yet. Because when you use it, you find out that your ass is not covered. So there's a lot of myth making going on here. Now let me spend a minute on the public option business. And if I'm correct, I saw Greg the other day when I was up in La Jolla arguing with Dr. Howard Dean about his support for the public option. Dr. Dean is going around the country on a book tour. He has his own organization called Progressive Democrats for America. And he is a very big public option advocate. He also, DFA has put out lots of wonderful information about how dastardly the insurance companies are. But Dr. Dean wants to choose the practical approach. Well, when he was chairman of the Democratic Party, he did a 50-state approach. And no one said that was practical at the time. And if he hadn't done that, maybe we wouldn't have had a President Obama today. Dr. Dean laid the groundwork across this country, which Barack Obama built on, that helped him become president. And so Dr. Dean, by his own behavior, has pointed out that fighting the conventional wisdom and reaching for the optimal is not the enemy of the practical. So I pointed that out to him in my own humble way. Now, the public option has two, maybe three major faults, total catastrophic faults, okay? Number one, it's modeled after the Massachusetts plan, which that radical Democrat Mitt Romney invented. But the Massachusetts plan works through private insurance companies, okay? So number one, it's extraordinarily expensive. People in Massachusetts have an affordable health care premium which may be subsidized. But when the insurance companies submitted their premiums to the Massachusetts Connector originally, 100% of their proposals were unaffordable. So the Massachusetts authorities said, buzz off, come back again with new proposals. So the insurance companies made their proposals affordable. But what did they do? They raised the co-pays and the deductibles. So a person with a family of four might be able to get health insurance in Massachusetts for $200 a month premium or $300 a month, but they'll have a $4,000 a year deductible and various high co-pays. So a family making, say, $40,000, if they're lucky, may end up having a $5,000, $7,000 financial responsibility for a catastrophic illness, being fully insured by a subsidized insurance program. And even then, the premiums that the state of Massachusetts is paying on behalf of its citizens are being too much, and they're really, really negatively impacting the state budget. The second problem in Massachusetts is now everybody's insured, but they don't have any family docs. So people are waiting in line, and people are unable to get medical services because all the primary care providers, nurse practitioners, physician assistants, and family doctors are overworked. There is no healthcare system. There's a bunch of individuals, and we spent these years, as I showed you, promoting specialists and not the ordinary people who practice practical medicine. So there's a problem there. So those are the two main problems in Massachusetts, and the main problem with the public option is that it does nothing to save the incredible overhead of the insurance companies, which they're siphoning off from the system. It doesn't simplify that. It doesn't save enough money to help invest in insuring the uninsured. And in fact, it gives a major subsidy to the insurance companies, which they're going to loft all the way to the bank. And it's going to make them more powerful, and it will not ultimately solve the problem. It's like building the bridge halfway over the canyon, and it doesn't quite get you to the other side. Because the government's going to subsidize. The government keeps saying, the president says, we want to have universal access to health insurance. He never says we want to have universal access to medical services. This is all the reforms are for universal health insurance. That's not the issue. We don't want universal health insurance. We want universal access to medical care. And we want to save the money from health insurance to spend on medical services. Yes, ma'am. The question was why no one talks about a free public health system like we have a free public education system. I have to say that's the American way. That's my only answer. I would tell you that I was very pleased to read a book. There's a book called The Political Economy of Healthcare by an English general practitioner named Julian Tudor Hart. And he pointed out that his optimal model for health services was not a commercial relationship, but a gifting relationship. And as a physician, I am very enamored of that phrase, that I really belong to a profession that's interested in service, and that's why I put social equity down there too. And I think it's un-American I have recently talked to some people for the Ecumenical Council of San Diego to give a presentation similar to this to their religious people, because I think they have a great role to play in changing the mind of our country to get away from the commercialism of this profession, because it's really basically a moral issue. And the moral issue has been lost over controversies like abortion and homosexuality, which have nothing to do with how people live their lives, really. The other thing I would say is that it's a tragedy that discourse of this nature can't be held on television. The only time you'll ever see, you can go to PBS, and there's been a couple of Bill Moyer's show actually speaking honestly about the healthcare system. But otherwise, there's been zero publicity in the national media about this issue on this level.